I'm pleased to say the very common sense-minded Dr Andrew Amos joins me now. Terrific to have your company, Dr Amos. I think it's really important. We throw around a lot of terms in this debate. I want my audience to understand exactly what this gender affirmation model is in practice, how it works, and just how prevalent it is in Australia, but what's happening with it around the world.
Thanks, Peter. Look, it's a fairly complicated model, so the international manual runs to a couple of hundred pages. But the key factor is in the name gender affirmation. So affirmation means that health professionals, including doctors, cannot evaluate the nature and causes of self-reported gender identity of confused kids and teenagers. So once a child presents reporting a gender identity that is different to their biological sex, gender services can then start them on the gender-affirming treadmill. So this starts with changes to their social relationships, and at older ages will often proceed to medical and surgical treatments that physically change their bodies. It's difficult to give a precise answer about the prevalence because the services that provide gender-affirming care have resisted calls for the release of their data, but freedom of information requests here in Australia have forced them to admit that the vast majority of gender-confused kids presenting for care in Australia will be treated under this model. It's also been a very dominant model around the world, although some places are starting to step back from it.
All right, I can't think of any other area of medicine where the patient gets to self-diagnose. So you're a psychiatrist. If I presented with anorexia, if I was of a very low weight, but thought I was overweight, grossly overweight, you would put me into care. You wouldn't affirm that I was fat when I was very, very dangerously thin. Why aren't we looking at other options, mental health care for a young person that presents with gender dysphoria before we go down the path of just accepting what they say? I mean, we don't let a kid of 10 tell an oncologist they've got cancer without the doctor saying, well, yeah, you do or you don't.
Well, you've given a very good summary of my paper, Peter. Look, I argue in my paper that the model does abandon the traditional medical approach, which is assessment followed by diagnosis leading to treatment. So in place of that medical approach, the gender-affirming model of care substitutes a political goal, which is explicitly to increase the number of people identifying with a gender different to their biological sex. So, Peter, it should be noted that advocates aren't hiding this. They do state it directly in their documents, and they frame it in the language of human rights. So I think you're right to bring up the fact that other conditions such as anorexia nervosa, you don't provide treatment for those sorts of conditions without a clear diagnosis and good evidence that it's going to actually improve the state of the patient in front of you.
You are a brave medico who's put his head above the parapet on this issue. We know people get cancelled around the world if they just want to ask reasonable questions. You may have colleagues that aren't as brave as you. What's the general feeling in the medical psychiatry, at least, community?
Well, look, it's an interesting situation. There certainly have been people who've been what I would consider have been punished for raising the sorts of questions that we're talking about here. So Gillian Spencer, a colleague of mine, was suspended from Queensland Health just for asking these sorts of questions. I think that's had a bit of a chilling effect generally amongst doctors and psychiatrists in particular. Seems to be fairly good evidence that if you stick your head above the parapet, it might get shot off. Despite that, I think when you talk to people, when you talk to psychiatrists and other doctors, there are quite a few people who are looking at what's been happening in the world and think, I have concerns, and they are reflected in the problems that I'm seeing. So, look, I think the tide is changing a little bit, but it's really going to take big changes in the system in order for people to be able to say, I agree with this, questioning this approach, and I think we need to step back a bit.
Do you support the idea that we have an inquiry, either at a state government level or a political federal government level, and get experts on all sides of this argument to the table to present evidence like they have in other countries?
Oh, look, I would strongly support, and I think it needs to be a national investigation. In particular, I think that would give cover to those people who have been scared to talk about their concerns. I've given some talks across the country, and individual politicians, for example, have said that they found it very difficult to move the needle on this issue as individual concerned politicians, but also parents. But the international scene shows that once we start looking at the evidence, the need to reverse the course is obvious and it's urgent.
Dr Andrew Amos, congratulations on your paper and thank you for your time.